There's a new Count Me In campaign aims to quell COVID-19 vaccine skepticism by sharing real stories to highlight support for getting vaccinated. Here to talk about it is Karen Jones. We're going to talk about the impact and importance of this campaign. Good morning, Karen. How are you?
Good morning, and thank you so much for having me.
Well, thank you so much for joining us on Morning Blend. Now, why is it important to lead a conversation on equitable access to authorized COVID 19 vaccines?
Well, the COVID-19 Vaccine and Education Project was convened by three organizations: mine, the National Caucus and Center on Black Aging, NCBA, the Alliance for Aging Research, and for Healthy Women. And we have been able to get a coalition of over 170 organizations to work together to provide information about the clinical trial process, the regulatory review, and the distribution and the access to the vaccine in a way that will promote trust and equity. And that's why we came together.
Now, how's the project promoting the impact of COVID 19 vaccination?
Well, we knew early on that dialogue and information were crucial. Had been so much misinformation, and then just the long systemic distrust that goes in, diverse communities. And so we knew we wanted to get the facts out. So we followed the process. We got all of the information. We facilitated and hosted webinars with experts who were related to the pandemic to bring that information to various communities. We created resources and we had open conversations and dialogues about the vaccination that we felt would encourage people to not only ask questions, but to get them answered by experts. The other thing we did is we made sure we partnered with trusted voices from various communities so that they could really get the word out and that we could get people to understand the importance of them being vaccinated.
You know, how many and what sort of organizations are involved in this campaign?
Oh my goodness, we have such a variety of organizations, aging organizations, we have retail organizations, we have research organizations, we have disability, of course, diverse organizations in terms of representing different diversity groups. It's just such a wide variety of groups, medical, I mean, everybody. We were able to attract so many organizations. We're so pleased that they have partnered with us because each one of these organizations have their own network and their own constituencies that they reach who people trust and want to get their information from. And so it has been wonderful to be able to reach so many thousands, millions of people through this COVID-19 vaccine education and equity project. And again, it was to make sure that people had the right information, the facts, so that they would be comfortable in receiving this vaccination.
You know, Karen, it's very interesting that you bring that up. Being African American, I have family members that, first of all, are not interested in the Johnson& and Johnson because of past history of Johnson& and Johnson. They'd rather get the Pfizer or Moderna. And I have one family member who's not even interested in getting the shot at all. Now, on the flip side, I have non-African American friends who still believe it's a hoax. I'm not going to get the vaccine. I'm not even thinking about it. How can we convince these people that the importance of getting vaccinated and what's going on in the country?
Well, let me just tell you, I was a converter. When this first came out and they started talking about a vaccine and the process, I was a bit concerned and a little hesitant just because you know of the history of medical experimentation and the problems that the African American community has been through. It goes far beyond Tuskegee and all of those things. But as I got more information and facts about the clinical trial process, we ensured and worked very closely with the CDC and the FDA on the regulatory review that no corners were cut, that everything was to a gold standard. We had many participants of all races, all nationalities involved in the clinical trial process, which was also very convincing to me because normally that doesn't happen. And, we wanted to make sure that the distribution and the access to it was there because, as you know, our communities were disproportionately affected. So the only thing I can tell you is that you need to tell your friends who all listen to have trusted voices again in their communities. They need to talk with them and maybe they'll get some self-assurance. We know we won't be able to convince everybody, but if you care about the people that you love and you care about the community, which you know has been affected most by this virus, when you have over 550,000 people dead, that's not a hoax. That's a reality, and a lot of that was African Americans and people of color. This is something that we have to be invested in and that we have to be a part of. So I would encourage them, we have a website where if they want to get more facts, they can go to covidvaccineproject.org. We have another campaign that we started called Count Me In, where we have different people from around the country who I'm sure some are people who had converted after they got the facts. They can go on our website and join in and see those people who have participated and shown that they've gotten the vaccine. And hopefully they'll understand that we're all really in this together, particularly in communities of color. We have got to make sure that our people are protected against this virus.
Karen, thank you so much for joining us on Morning Blend. You're very right. You're so true. So one more time, could you please give us that website one more time?
Absolutely. It's covidvaccineproject.org. And we hope everybody will come on. And if they have any other questions, please feel free to contact any of us who are the conveners. Again, National Caucus and Center on Black Aging, Alliance for Aging Research, and Healthy Women would be more than happy to provide them with information. Thank you.
Karen Jones, thank you again for joining us on Morning Blend.
Thank you for having me.